Okay, good afternoon, guys. I've got some extra helpers with me today. Got Katie and then Allie, my oldest. And there's our little friend Maverick up there.
I'm pretty sure he's eating my hair and has already pooped on my shoulder.
All right, so that being said, let's dive into part 4 now. When your story becomes checkboxes. In the last video, I talked about how information gets gathered when you call a doctor's office and try to be seen. But there's another step that most patients never see, and that is what gets written down. A medical record isn't just paperwork. It's how your story gets passed from one clinician to another. It's how the next person caring for you learns who you are and what's been happening to your body. Or at least that's what it's supposed to be. In healthcare today, much of documentation happens through structured templates.
And those templates serve an important purpose. They help standardize care. They help make sure key elements aren't missed. They help organize large amounts of information quickly and consistently. But templates can only capture what fits inside the structure. And a patient's story doesn't always fit neatly into boxes.
As a nurse, I learned that the way something is written down can shape everything that comes next. A symptom that isn't documented, a detail that's missed, or something that gets misunderstood in translation. That can quietly follow a patient into their next visit and the visit after that. And as a patient, I have experienced how deeply that really matters.
When your story isn't fully captured or when it's incomplete or inaccurate, it doesn't just disappear. It can shape how future concerns are interpreted, even when that was never anyone's intention. A medical record isn't just a record of what happened. It's often the first introduction the next clinician has to you.
As both a nurse and a patient, this part of the conversation is deeply personal for me. When I first became ill, much of what I was experiencing wasn't fully reflected in my medical records. As the months went on and my condition continued to change, those gaps didn't just affect one appointment, they followed me into future appointments. They affected how my story was communicated from one clinician to the next. They affected referrals. They even affected the documentation needed when we applied for disability. Over the course of 3 years, I went from working full-time, caring for my family, grocery shopping, and living a very active life, to relying on a cane, a walker, and now a wheelchair is needed anytime we leave the house. Not every part of that progression could have been prevented, but accurate documentation matters, because once a person's story is incomplete on paper, it can become much harder for others to see the full picture. That's one reason this conversation matters so much to me. And that's why documentation is not just about checking boxes. It's about how accurately a human being is represented when they are not in the room. Because once something becomes a checkbox, it can lose the context that gave it meaning in the first place. And context is often where clinical understanding lives. So when I talk about documentation becoming checkbox medicine, I'm not talking about technology itself. And I'm not talking about the clinicians doing their best within those busy systems. I'm talking about what can happen when the story of a patient becomes reduced instead of understood.
Because patients don't experience health care as checkboxes. They experience it as moments, symptoms that come and go, questions they didn't know how to ask, answers they weren't sure they understood, and fear when things don't make sense.
And if those moments don't make it into the record, then part of the story can get lost before the next person ever sees it. And that's what we want to talk about next.
Because sometimes what patients remember most isn't what was written down, it's what they felt was missing. And that leads us to the final part of this series, so stay tuned for tomorrow. Never lose sight of the person behind the symptoms. Remember the human in healthcare. This is just a nurse writing from a patient's chair. Thank you for listening, and we'll see you again tomorrow.
He's walking away.
He's done.